Welcome to Career Day. Today we have
Dr. Karen Wasilewski Masker, otherwise known as
my mom.
Jamie's mom.
So, what is your profession?
Well, I'm a doctor.
A real doctor?
A real doctor.
A real doctor.
Like an MD medical doctor.
Oh, okay.
And specifically, I'm a pediatrician, so I take care of kids. And even more specifically, I am a pediatric hematologist oncologist, which means I take care of kids that have blood problems and cancer.
So, how many years of college does it take to be a pediatric hematologist oncologist?
It takes a lot. So I went to college for 5 years because it was so much fun. I stayed for an extra year. And then I went to medical school for 4 years. And then after that, I did what's called a residency where I was training to become a pediatrician. And that was for 3 years. And then following that, I did what's called a fellowship to become a pediatric hematologist oncologist, and that was another 3 years.
So anyway, you don't have to add that up, but it just means it's a lot of years.
It's a lot.
So where'd you go to school?
So for college, I went to Penn State. We are
Penn State!
Woo! And then for medical school, I went to Vanderbilt. Go Doors. And then I stayed at Vanderbilt for residency, and then I came here to Atlanta to Emory to do my fellowship.
Nice. So, Miss Karen, where do you work?
I work at Children's Healthcare of Atlanta. I work at the Aflac Cancer and Blood Disorder Center at Children's Healthcare of Atlanta at all 3 campuses. So there's Scottish Rite, Eggleston, and Hugh Spalding.
So, what is your favorite part of your job?
My favorite part of my job is working with the kids and taking care of patients. They are awesome. They're a lot of fun. Even when they're sick, they just want to get through it and get up and play. But I also, I just like to help people. So I like helping my patients, but I also like helping the people that I work with. So I work with a bunch of awesome nurses and doctors and nurse practitioners and other people where I work, and that's part of my administrative job is helping to take care of them too. So I just like helping people.
Great job. So what does your day look like?
Well, my days are long, but the good thing about being a doctor is you can do lots of different things.
What are they?
I don't do the same thing every day. Some days I teach our residents and our fellows.
She teaches.
So those are the doctors that are learning. Some days I take care of patients. So,
real patients.
Either in clinic or in the hospital, either kids that have cancer or have blood problems. I do research.
Real research, guys.
And actually most of my current job is doing administration, which means I help kind of run things for the practice and all the other doctors.
She's kind of the boss.
I'm not really the boss, but
she's like
I'm
the
a medical
boss.
doctor.
Yeah, she's like.
Anyway, that's what I do.
So what advice would you give to somebody who would like to do your job?
So the first piece of advice is if you ever want to be a doctor, you have to get good grades in school.
Be smart, kid.
Gotta work hard. The other piece of advice is that you have to really want to do it because it is a long road and all your friends are going to be having real jobs and making a lot more money than you do way before you do. But mostly you just have to have a passion for it and want to help people.
Like have a real passion.
A real passion. So those are my recommendations. You need to work hard in school. You have to follow your dreams, and you have to be willing to sacrifice some things.
Okay, thank you.
No worries.
Thank you for watching today's COVID-19 Career Day episode. Make sure to wash your hands and stay socially isolated.
Washing hands is fun.